First, we have the normal healthy knee. In the left knee, motion is primarily in the sagittal plane with some transverse plane movement due to the tibial external rotation during the movement of cutting. There is left knee flexion while the right leg plants, extension during right leg push-off, and external rotation as the tibia rotates in preparation to plant with the left. During the non-weight-bearing instance, there is tibia on femur posterior roll and slide during flexion, anterior roll and slide in extension, and tibial external rotation on the femur during knee external rotation. Muscle forces acting on the joint include concentric contraction of the hamstrings and passive eccentric contraction of the quadriceps muscles to control the limb during movement. Moving on to the right knee, motion is primarily in the sagittal plane with secondary frontal plane motion during the cut due to knee valgus. There is some transverse plane motion here as well. There is right knee flexion while the right leg plants, extension and slight valgus during push-off, and slight external rotation. During plant, there is femur on tibia motion with a posterior roll and anterior glide for flexion. During push-off, the femur rolls anterior and glides posteriorly for extension. Muscle forces acting on the joint include eccentric contraction of the quadriceps. Simultaneously, there is concentric contraction of the hamstrings and popliteus for stabilization of the limb.
When it comes to the impairment in the right knee, more specifically a right knee meniscal tear, we can start to observe and predict some impairments that would occur as a result of this tear. So, starting with the left knee, we're gonna see that it's gonna be primarily sagittal plane, secondary transverse plane movement during the pivot. So, starting that pivot, we're gonna see the movements in those planes. Something that we would observe is decreased knee flexion with an increase in knee extension and increased knee external rotation. This is going to be due to the left limb preparing to plant earlier due to decreased weight-bearing tolerance in the right as a result of that tear. Moving on to the joint arthrokinematics and osteokinematics, we're going to see that the left knee has increased weight bearing as a compensation of the unstable right knee. The femur on tibia motion is going to be a posterior roll, anterior slide, and flexion. You're also going to see an anterior roll, posterior slide, and extension. Femur is going to be laterally rotated, so internal rotation is going to start to occur. Then for the muscle forces that are acting on the knee joint, the compensation that we'll see of the left knee is increased assistance from the quad muscles, such as the vastus lateralis eccentrically, vastus medialis eccentrically, vastus intermedius eccentrically, and the rectus femoris eccentrically. So that's wrapping up the way the left knee is seen in the impairment on the right meniscus. Now moving on to the right knee, we're going to see that the planes of motion of this impaired limb is going to be slight limited sagittal plane motion due to decreased weight-bearing tolerance. We're going to also observe some increased frontal plane motion due to the increase in valgus and planting and pivoting. Again, that's due to the meniscal tear occurring and that kind of like block not being there. In the transverse plane during movement is where we'll see this valgus occurring when we see the athlete start to plant. The joint movement, we'll see that the right knee has reduced knee flexion during planting, reduced knee extension and push-off, increased valgus in plant and pivots, and reduced external rotation. The right knee osteo and arthrokinematics is going to be seen to have some decreased in extension due to the right meniscal tear and the hesitance to apply any weight bearing on that limb. So we'll see decreased step length and avoidance of loading through the knee in bending. We we'd see the muscle forces of the knee joint on the right side decrease in terms of the weight bearing and activation of the muscles. Again, this is a compensatory behavior due to the injury in the right meniscus.
All right, so here we have two photos of the exact moment of pivoting and cutting performed by Nick. We have them side by side to express the biomechanical changes between these exact moments of pivoting between the healthy and non-healthy. Here on the left-hand side, we have Nick with a healthy cut using that intact meniscus. Here, the biggest difference is the fact that he is only in single limb support. He is only using this right limb to propel him, while the left limb, the muscles are activating, such as the hamstrings pulling this tibia to create knee flexion. Nick is doing this to clear his left foot on the ground to set himself up for the next step. Again, he is only using the right limb to single support this movement. On the right-hand side, we have Nick now performing this pivot with a right torn meniscus. Here, we have increased knee external rotation on the left-hand side and decreased knee flexion on the left-hand side. This is because Nick is now no longer trying to clear this foot off the ground, but he is trying to use his left limb to also propel him to the side. On the right, we have increased knee valgus and decreased knee flexion. Again, he is no longer just using his right limb to propel him off the ground. He is using both the right and left limb. The decreased knee flexion is because because of this torn meniscus, Nick no longer wants to load this knee as much as he possibly can, but instead he's reducing this arthrokinematic motion to put less stress through the meniscus and through the knee, and to propel himself with less force, again using both the right and left limb. So we have the biomechanical comparison at this exact moment of pivoting shown here, and the differences in the biomechanics highlighted in the red font, along with that dual point of contact highlighted on that right side.